Okay, we will have Dr. Chelimsky's recording in full. We will get that recorded and we will send it to everyone post-event, so apologies about that, but we can't control other people's Wi-Fi. But we do have Dr. Pocinki joining us virtually, which is fantastic. There you go. Hi, Dr. Pocinki. Hi, let's say hi to Dr. Pocinki from Arizona. Can you hear us?
This is working.
Fabulous. Sorry, we had a few tech issues, but I think we're okay now. I'm just waiting for the questions to be brought to me. Poor Sasha running. Some jazz. Okay, we're ready now. Let's do this. Okay, thank you all for your patience. Appreciate it. Thank you, AV team, for bringing us back. Okay, Dr. Knight, we're going to start with you, please. Can my primary care doctor help me with diagnosing and managing head and neck problems, or is it always necessary to go to specialists for these issues?
Yeah, that's a great question. So primary care certainly has a very important role, and the role is usually the starting point. So if there are some symptoms that do seem to be new or changing, then definitely want to go to your primary care to begin with. Now, if that's going to require more specialty consultation, that's something your primary care can also help with. So what is within their scope? Usually, most common headaches that Dr. Saperstein went through can be managed by a good primary care doctor who is familiar with some of these medications, first-line treatments, and things like that that help with tension-type headaches, cervicogenic headaches, or migraine headaches. And then from there, they might get a little bit outside of their toolbox, so then that could be where they consult a specialist. But no, certainly to begin with, you don't need to see a specialist, but definitely do want to bring that to the attention of your primary care. So, great question.
Thank you so much. Dr. Saperstein, are there any peer-reviewed research that supports formally upright MRI imaging for EDS patients?
So there is peer-reviewed research that shows there's a higher incidence of finding Chiari's or low-lying cerebellar tonsils with upright versus supine or conventional MRI. It's not. There aren't huge studies, so there are. Again, the magnitude of the difference is not great, and there's a trade-off because the open MRIs or the upright MRIs are more open, so you don't get as good a picture as you do with a conventional MRI. For any of you who's had one, you know how confining that tube can be, but that concentrates the field, so to speak, in a magnet. So I use upright MRIs in certain situations, but honestly, mostly I use the conventional MRI.
Thank you. Dr. Hashemi, am I saying that right? Hashemi?
Absolutely. Yeah.
Great. Do dental implants fail more often in EDS and HSD patients?
Can you repeat the question?
Sure. I have to tell you, by the way, it's so hard to hear the microphone on the stage, the question, so I feel your pain. Do dental implants fail more often in EDS and HSD patients?
It's a great question. I don't have any experience in seeing patients with failed dental implants, so I would have to do some PubMed research and speak with our colleagues that implant and to see what the failures are. So I don't want to comment on an area that I don't have experience in.
Thank you. Emily, is there anything to help with vision changes during flares?
During flares, vision changes. So yes, visual visual symptoms are really common in both autonomic dysfunction and in Ehlers-Danlos, probably under-recognized. there's, you know, tricks and things like some tapping tricks that you can do in the moment and some visual field to sort of help with grounding. Using some autonomic regulation strategies like some weight sometimes helps with some of that vision stuff. But I would say long term, it's really more looking at vision rehabilitation, and if there's not enough strength in the eyes, you know, working on strengthening of the eyes, working on helping the eyes to be able to work together, not just about how well you can see acuity-wise, but there's a whole assessment that we can do in terms of function of the eyes. So some things in the immediate, like those that I just recommended, including autonomic regulation strategies, but then more rehabilitative, longer term are worth looking into.
Great, thank you. Dr. Pocinki, are sleep apnea machines helpful and safe for those with EDS and HSD?
Not my area of expertise, but yeah, I haven't had any issues. I haven't had safety issues with patients using home apnea equipment.
Okay, thank you.
Yeah, I would recommend the so-called AutoPAP, the machines that self-adjust and self-titrate so that you can get the pressure varies depending on what your needs are, particular night or particular time of night.
Thank you. Dr. Knight, what is the reason that sleeping on the right side of the body is helpful?
Well, you might have had some injuries on your left side of your body, I don't, possibly, but there could be lots of things. So we definitely know when we go through these discussions with Emily, occupational therapy, physical therapy, that your body is working in balance, right? So if you do have injuries on one side or another, if you're favoring the opposite side and you're having more muscle tension or ligament injuries that you might not even be noticing, then you could certainly develop pain in any region, and it can be widespread, as many of you might notice. But if it's one side or another, that's definitely plausible. So do want to be mindful of that. If the pain is increasing in certain areas, that's the time to check back in with your physical therapist. Maybe go through another exercise regimen, see something that's going to focus on those areas, and go from there. So in the meantime, if it's more comfortable, certainly stay on that side.
Perfect, thank you. Dr. Saperstein, what do you think of Prolotherapy or PRP for cervical instability CCI? Have you seen any success with it?
So I have seen success. I mean, the trouble is, in contrast, the first question I got was, is there peer-reviewed literature? If there is on this, I'm unaware of it. There is literature on prolotherapy, although, you know, there's not consensus on when and or whom that should be used. In terms of CCI, again, anecdotally, I've seen patients undergo it and benefit from it. I've seen patients undergo it and not. I think you know, certainly the people who do it will concede that not everyone will benefit, and like a lot of things in EDS, we don't know. You know, the trick of it is going to be figuring out who's the best candidate for what sort of treatment, and right now it's certainly an option, I would think, but we don't have quote-unquote proof.
Thank you. Emily, does the type of salt matter, iodized, natural Himalayan, or sea salt as examples?
Everybody has different opinions on this. From my survey of lots of different medical professionals, most people say no. It's really like, what are you going to eat? You know, if you prefer the taste of one, then that's the best one for you. But I think there are some people who feel that, you know, Himalayan sea salt is better than the others, but, you know, it depends on your budget and your abilities. And I think, generally speaking, just getting in that salt, it doesn't necessarily really matter what type.
Thank
Just
you.
adding to Emily's comment, that's totally correct.
Hello, welcome.
Sorry, I don't know what happened. I did the whole talk, but I think that to myself.
Welcome back, it's good to see you.
Sorry.
Okay, let's find a
But
question.
No question, it doesn't matter. We just need sodium chloride.
Okay, great. And while we have you, Dr. Chelimsky, have you found any links between IBD like Crohn's disease and heads and or POTS?
No. I would say that IBD patients can develop functional GI disorders like it can happen with any acute infection or inflammation or chronic, but there is no association between IBD and POTS, except they are dehydrated but then a secondary POTS.
Great, thank you. Dr. Pocinki, how much does ambient temperature influence the impact of autonomic dysfunction on sleep?
I don't know. I've always included in my slides that your bedroom should be a comfortable temperature for you. I think most people sleep better in a room that's cooler, but to quantify how much effect temperature has on sleep, I don't know, sorry.
No problem. I'll try and find a better question next for the next round. Dr. Knight, how could we best explain our symptoms so that doctors believe us and what we are feeling?
I just want to, sorry, I didn't get the last part.
How do we best explain our symptoms so that doctors believe us and what we are feeling?
Yeah, that's an excellent question. I know many of you all have had experience with that. So explaining the symptoms, and the symptoms can vary so far and wide as we have specialists from so many different areas. So what I encourage my patients, and sometimes there is a limit from the amount of time that you have at that first visit. So you do want to focus on the most important and the most troubling symptoms first. Okay, even if you don't identify them as to be the most severe, what are those that are impacting your life mostly, because that's going to be limiting your functional ability, right? And we know that when your functional ability starts being lost, then all these things can cascade from there. So what is it that's really limiting you on a daily level? That's what you want to address first. So how do you describe those symptoms? Just be as specific as you can. The location, the duration, the timing. If there's anything that causes it to be worse, anything that you've tried to make it better. We don't really need to go through all of the details of all the surgeries and things like that on that first visit. There might be a chance the physician you're seeing has a chance to look at that before your visit or after, but it's really important for them to know as they're doing that physical exam, what are they going to be looking for, so they can help diagnose and make those orders, referrals, or whatever it is that's going to help you. So do think about that also ahead of your visit too, and how that can be helpful. So very, very good question.
Thank you. Dr. Saperstein, how do you know if you're overstretching the neck, causing more damage?
That's a good question. So in my patients with EDS, hypermobility, I work very closely with physical therapists who are knowledgeable about these diseases. And, I think it's important, to work with someone like that, or, work with some sort of physical therapist who can, see what you're doing and kind of give you guidelines about it. Because people, as you know, a lot of your joints you can bend in certain ways, and that's always the question of, should you be doing that? And I think for any joint, it's important to get, sort of a game plan.
Thank you. Dr. Hashemi, what are your thoughts on wearing mouth guards for TMJ? I've heard it can alter the position of the teeth and jaw.
Good, great question. So the role of mouth guards in TMJ, just backing up, we look at temporomandibular disorders, from the muscle and from the joint pathology. I think that first establishing sort of the relationship of the disc on MRI to see what first our starting point is, and to see if the mouth guards can influence the joint dysfunction. And separately, I think it's imperative to consider the muscle contribution to the TMD, if you will, from that overall umbrella.
Thank you. Dr. Chelimsky, other than cardiac testing, what testing do you recommend should be done?
Are we talking about autonomic function or?
Yes.
So the classic battery of autonomic testing that Mayo does, that we do and most of the labs do, is obviously the deep breathing, the Valsalva, the tilt table, and the pseudomotor, which looks at our autonomic neuropathy. Some centers do pupillometry, cold water, but I would say that just doing the basic battery, and if needed, doing also the thermoregulatory sweat test, which would they put you in a kind of in a sauna. They cover you in a powder, and they put the temperature up to 50 degrees Celsius, and getting the body temperature to increase by 1 degree, and they look at where you sweat and where you don't sweat. So that is that looks at obviously the sweating function, but also helps you localize in the autonomic nervous system where the lesion is, if it is central or if it's a peripheral lesion. And usually with those 5 tests, you get most of the information that you need.
Great, thank you. Emily, do you have suggestions for people who cannot wear compression stockings because of the mechanical friction causes an MCAS flare? For example, can an abdominal brace be worn alone?
Yes. Yes. Yeah, this is not uncommon that people have reactions from a mast cell perspective, and some of these leggings that they recommend have silicone dots on them, which I've seen those cause mast cell flares. And so sometimes I've had success with folks using like Spanx shorts or some other skin tight shorts that go under that, and then the silicone dots can go on top of the shorts. But abdominal binder, I didn't say that in my lecture, and I should have. It is absolutely helpful in isolation in most patients. So there was a study done 2021 last year that showed the second best to using leggings plus an abdominal binder is just the abdominal binder by itself. It's gonna be a whole lot easier on your joints to put on. It's a lot more practical. So absolutely an option. You can wear a shirt underneath the abdominal binder if you have any reaction with the friction on skin. So yeah.
Thank you. Dr. Pocinki, is Dr. Pocinki still there?
I think so.
Okay, can we get Dr. Pocinki on the screen, please? There we are, we see you now. Okay, is edible medical marijuana okay to use as a sleep aid, as I've read very mixed opinions on this?
I think this is just another great illustration of different things work for different people. I do have a small number of people who find that medical marijuana really does relax them, help them fall asleep, and even help them sleep better. In general, there's no panacea. A lot of people find it's not helpful, but it certainly can be. And if you especially if you don't do well with pharmaceuticals in general, it's a good thing to try. Or if you've failed a lot of pharmaceuticals, then it's certainly reasonable to try some form of cannabinoid to help with sleep.
Thank you. Dr. Knight, in your opinion, how closely intertwined is cranial cervical instability and autonomic dysfunction?
Wow, that's a good question. So, in my opinion might not matter as much as the science does, but we definitely do see them together. The ones that you might want to ask are maybe Dr. Henderson, maybe even Dr. Saperstein can give some input on that. But we do know that there is a complex autonomic function based on the nervous system, peripheral nervous system, central nervous system, which nerves are actually in those areas where you could have instability. So the idea is that impingement or abnormal movements, hypermobility, for example, could affect those nerves, and that can lead to some autonomic dysfunction. How much it says, again, my opinion might not matter as much as the science does, but we do definitely see patients with those both together. So it is something to be aware of, something to be looking out for.
Thank you. Okay, Dr. Saperstein. I'm trying to find the best one for you. What pillows or stabilization can be used at night to help someone get a better night's sleep?
Yeah, I'm not sure. I mean, everybody's a little different, and oftentimes I seek guidance from physical therapists. I don't know if Emily take that one.
Yeah. So thanks. Lots of different pillows out there. There's memory foam, there's feather ones. No, but really, I think just finding the one that works for you. I often recommend people go to a mattress store and just try out pillows. There are positioning with pillows. You know, there's pictures on Google, on Instagram, and resources that you can explore different ways to use pillows to make you have the best night's sleep. The research actually doesn't really support positioning helping sleep that much, but I think when it comes to falling asleep, trying to fall asleep in the best, most supportive position for your body, and so getting those pillows in the right places for you. But I don't have patients say, you know, memory foam is the best for me consistently. It just really depends on the patient.
Sure, thank you. We will ask you another question, Dr. Saperstein. Is there any risk to Botox injections into the neck muscles increasing cervical instability?
That concern comes up a lot. You know, Botox when we're injecting Botox, we're not doing it at doses to necessarily weaken the muscles. Botox, it's interesting how it works and blocks pain signals, but it certainly can weaken muscles. Most patients do fine. Some patients do find that they get weak from it. It's an individualized decision. You know, as I alluded to, there's a whole array of locations where we inject Botox when we do it for migraines. So again, in some individual cases, we may avoid that. In some cases, you know, if there's a problem, then we just may remove that. But it's something to think about. I think most patients, it turns out not to be a problem, fortunately.
Thank you. Dr. Hashemi, have you found any success with TENS units to help TMJ issues?
We've had success with TENS units in other parts of the body and the peripheral nerve world. We have not seen significant success with TMJ issues when it's a joint pathology, when patients have spastic masseters or lateral pterygoids. Some of the higher frequency TENS provides anecdotal relief of those spastic areas. But for patients with TMJ joint pathology, we have not seen success in that sphere.
Thank you. Dr. Chelimsky, are motility issues in the esophagus common with EDS?
I don't know that there are good studies looking at motility in the esophagus and EDS. And so I don't know the literature. I know that there is a lot of feeling sometimes of things getting stuck, but I am not aware of good motility studies looking at EDS and esophageal motility.
Thank you. Emily, I've been recommended by multiple doctors to not drink things like Gatorade because of the sugar and harmful dyes, which are harmful to people with MCAS. What products can you recommend that are free of these things?
So disclosure, no relationship with any of these companies, but there's a brand called Normalite, which has a very pure form. I don't think it has any sweetener. There's something called, I'm going to forget all of the brands right now because I'm on stage and brain fog, but Tri-Oral is one that has an option, I believe. What is the one I recommend? Oh, LMNT is a great one, or Element, it's the letters LMNT. Those are three, and then also using the Vitacium salt stick. They don't have any sweetener or additives to them. Yeah, those are four that would be good.
Thank you. Dr. Pocinki, how can you best improve sleep without adding medication?
Well, the basics of good sleep hygiene. So don't do stimulating things right before bedtime. Don't take your phone to bed with you. And then I did included a slide on sort of non-pharmacologic measures, in addition to having a comfortable mattress and having the the bedroom be a good temperature and dark and quiet. Trying to get your bed partner not to make a lot of noise or move around too much. And then individual measures to sort of reduce sympathetic activity. So those can be just simple deep breathing, which stimulates the parasympathetic nervous system, guided imagery. There's something called sequential relaxation. There are a bunch of different techniques to stimulate the parasympathetic system. My experience has been they tend to help you fall asleep, but the benefits of those often wears off in 2 or 3 hours. And if you're if too much sympathetic activity is what's underlying your sleep disorder, that you may then wake up in a few hours. But there are a number of such non-pharmacologic measures to try. If you want to avoid medication, then they really should be tried first before you resort to medication.
Perfect, thank you. Dr. Saperstein, to what extent do regular radiologists read abnormal MRIs and CTs of EDSs as normal because they don't understand how CCI or AAI could present?
So I think I heard correctly, is to what extent do most radiologists read these studies as normal? Is that the?
Incorrectly normal.
Incorrectly normal, sure. A lot. So the measures that are looked at for CCI, so clival axle angle, some of these other measurements, they're not routinely incorporated in the read from a neuroradiologist, from radiologists. So, generally, the neuroradiologists I work with, I have them do that. I read all the studies myself and double check it. But I think there has to be some physician familiar with these measurements who makes them. I mean, the good news is you get the image, and so anybody can look at it. But yes, so certainly if a radiologist says the study's normal, you can look at it. If there's no mention of specific measurements, then you can assume they haven't looked at that.
Great, thank you. Okay, well that is the end of those sessions. So thank you so much to all of our speakers on the stage and virtually. And thank you to everyone for bearing with us with our technical issues. We really appreciate it. Just wondered, with a show of hands, how many people have got kids in our Camp Joy Junior Zebras thing? They've been having fun? Amazing. So we're gonna, around lunchtime, we're gonna get the kids and Camp Joy up on the stage and hear a little bit about what they've been up to the last few days and meet the team that's been behind all the amazing activities. Okay, break time everyone. We'll see you soon. Thank you.